All right, let's jump right into it. Welcome to This Explainer, where today we're unpacking a truly devastating and honestly urgent medical mystery that's been unfolding in Rajasthan's government hospitals. We're looking at a situation where routine medical care suddenly turned into an absolute nightmare for several families. It triggered massive statewide alerts, a frantic search for answers, the whole shebang. So we're going to break down exactly what happened, the specific medical interventions involved, and how this localized tragedy has kind of pulled the curtain back on a much wider, systemic crisis that's threatening patient safety everywhere.
To really grasp the scale of this issue, we have to start by asking what could possibly trigger a rapid series of fatal complications among newly postpartum women. Just picture the scene at the New Medical College Hospital in Kota. We're talking about women who have just gone through childbirth, specifically C-sections and uterine procedures, right? These are meant to be joyous moments, even if they're medically intensive. But instead, this deeply alarming pattern began to emerge. Multiple women in the very same hospital suddenly began crashing medically. It wasn't just one isolated anomaly. It was a cluster of crises that immediately signaled to doctors and health officials that something in their standard protocol, or maybe their supply chain, had gone terribly, terribly wrong.
Section 1. The Kota Hospital Tragedy. 5 Lives Lost.
According to preliminary reports, this medical crisis has already claimed the lives of at least 5 women in Kota's government hospitals right after they underwent C-sections and uterine procedures. And the speed of this crisis was just terrifying. We aren't talking about a slow decline over weeks here. Just 8 to 12 hours after routine surgery, these patients experienced a sudden, catastrophic drop in both their blood pressure and their platelet counts. And almost immediately alongside that, doctors started observing the alarming signs of kidney failure. Going from childbirth to severe, multi-organ failure in just a matter of hours, that is incredibly rapid, and it strongly pointed investigators towards something that was introduced into the patient's systems either during or immediately after their surgeries.
Section 2. What is oxytocin? A critical medication.
The focal point of the investigation quickly zeroed in on a medication called oxytocin. Now, to grasp why this matters, we need to understand the absolute life-saving role of this drug. Oxytocin is a standard, incredibly common injection given to women during and after childbirth. Its main job? To prevent excessive bleeding by helping the uterus contract. When a woman undergoes a C-section or uterine procedure, managing bleeding is literally one of the most critical aspects of postpartum care. This drug is supposed to be the safety net. So, setting up this context shows us exactly why a substandard or faulty batch of this specific injection isn't just a minor hiccup. It strips away a critical layer of defense. It makes it incredibly dangerous and potentially fatal for these postpartum patients.
So, when officials tested the Jackson Laboratories batch that was administered in Kota, the results were frankly shocking. A standard oxytocin injection absolutely must contain the active component required to prevent that excessive bleeding. But lab tests definitively found that this specific batch lacked that required active component entirely. It was literally missing the exact medical ingredient needed to stop the bleeding and save these women's lives. This completely failed quality testing, which obviously raised massive red flags that the medicine was either severely substandard or just entirely fake.
Section 3. The investigation and fallout, statewide response.
Naturally, discovering a compromised, life-saving drug in a government hospital requires immediate action. The government's response was rapid and multi-pronged to contain the immediate danger. As confirmed by Rajasthan drug controller Ajay Pathak, as soon as those samples failed the quality tests, Step 1 was initiated. All remaining stock of that oxytocin batch at the Kota hospital was immediately seized. Step 2. The State Drug Control Department officially banned its sale and completely halted its use statewide to make absolutely sure no other hospitals were using it. Step 3 involved accountability at the ground level, with medical staff linked to those specific cases in Kota being suspended, pending a full inquiry. And finally, Step 4. A high-level team from SMS Medical College in Jaipur was quickly dispatched to Kota, not only to assist in the medical treatment of the affected patients, but to rigorously probe the exact cause of these deaths.
Now, it's really important to look at this statement directly from the Kota hospital authorities. Because while we know for a fact that the oxytocin supplied by Jackson Laboratories lacked the vital active component, the hospital authorities stress that official inquiries are still working to definitively link the faulty drug to all of these tragic outcomes. The exact official medical cause of death for each of the 5 women is still under formal investigation, and the inquiry committee hasn't released its final conclusive report just yet. It's vital we report this impartially, right? The drug failed tests and patients died with matching symptoms, but the official medical consensus is technically still pending.
Section 4. A broader crisis. Counterfeit crackdown.
So the crucial point we're arriving at here is that this horrific, seemingly isolated tragedy in Kota, it's not happening in a vacuum. It's actually part of a much larger, systemic crackdown across the entire state of Rajasthan. 11. That is the staggering total of completely different medicines that have failed quality checks across Rajasthan in just the past 10 days alone. Think about that. 10 days, 11 different failed medications entering the public health system.
The scale of this issue is, well, it's terrifying. We aren't just talking about specialized surgical injections like Oxytocin anymore. Officials confirm that these substandard or fake drugs include everyday medicines. We're talking treatments for fever, allergies, basic infections, standard pain management, and even essential antibiotics. And get this, they aren't coming from just one rogue lab. They're manufactured across multiple states: Gujarat, Maharashtra, Delhi, Himachal Pradesh, Uttarakhand, Andhra Pradesh, and even right there within Rajasthan itself. Everyday medicines from manufacturers all across India are failing tests and somehow, someway, making their way into the standard medical supply chain where patients are relying on them to heal, not to be harmed.
Which brings us to the ultimate question we have to ask ourselves after walking through all this data. When the very medicines designed to save lives are actually missing their active ingredients, when basic antibiotics and pain relievers from all across the country are failing standard quality checks, how can we secure our medical supply chain against the deadly threat of fake and substandard drugs? As this explainer shows, the Kota tragedy, devastating as it is a symptom of a much, much larger vulnerability. It's a profound challenge for health authorities, and it's something that demands rigorous, continuous oversight to ensure patient safety. Thanks for joining me to unpack this complex and vital topic today. Keep questioning and keep learning.